Arne Sorensen was a lawyer who ultimately was at Latham and Watkins, and he was recruited away to be a lawyer at Marriott and rose up to be the CFO and then the CEO of Marriott, and did a spectacular job in that position for a number of years, the first non-family member to ever run Marriott. And then I think at the age of 51, 52, he contracted pancreatic cancer, and he had surgery at Johns Hopkins and had pretty good treatment, came back to work, and he did a number of events for us. I remember interviewing him once after he'd recovered from his cancer treatment at Hopkins, and he was back to work, and I thought doing pretty well, but sadly he lost his fight with cancer not too long thereafter. Because he was very involved with us, even though I kept saying, you're running Marriott, how do you have time to deal with being so involved with the economic club? But he showed up at all the meetings he was supposed to show up at and was very helpful in a lot of our different areas. And so we decided to create an Arne Sorensen Excellence in Leadership Award. Arne and his family, I think, were quite appreciative of that. And his widow was, I think, at the time we gave out the Arne Sorensen Awards, the first time we did it. Today, we want to honor 4 individuals who were helpful to this community and the club. During COVID, some of you may remember, we spent a fair amount of time with virtual sessions, and many of the virtual sessions were relating to health, because many people wanted to know what the health situation was. I tried to do as many interviews as I could virtually with people who are running hospitals and people who are involved in the healthcare industry, and we found not only were they helpful to the community at this time, but also quite helpful to the club. And so we thought it'd be appropriate today to honor those people with the Arne Sorensen Award. And to present the award, we have 4 people who are going to present the awardees with their Arne Sorensen Excellence Award. One is Tony Bizzelli, who's the Vice Chairman of Deloitte. And why don't you come up now? Okay, Tony Bizzelli. Alan DeBeery, who is Chairman of OneTrust Privacy Software. Come up. Okay. Leslie Hale, President and CEO of RLJ Lodging Trust. And Horatio Rosansky, President and CEO of Booz Allen Hamilton. Okay, so come on up. So I think, Tony, you're going to go first.
Yes.
Okay, well, why don't I get out of the way and let you do this.
Thanks, David. And Mary, thank you. Thanks for this opportunity to offer a few remarks about Ken Samet. I am very honored and proud to be here. We often say around our MedStar board that brevity is brilliance. And if I followed that this morning, I would simply say everyone admires and respects Ken Samet. But I can't stop there. I'll frame my comments in the same way that Ken frames his discussions with our board and with his leadership. Ken always talks about strategy, leadership, and execution, SLE. So, how did Ken's strategic thinking impact our region during COVID? As far back as 2010, Ken knew that it was critical that all 10 MedStar hospitals operate as one seamless system. That was an incredible task for him to undertake. Thankfully for the people in the region, systemness, Ken's phrase for the integration, was in place well before COVID. When the pandemic hit and beds were scarce, MedStar was able to deploy patients to an appropriate bed regardless of where they lived. There is no doubt that Ken's action, which started about a decade ago, saved lives. Leadership. Too many things to say. I could talk about how Ken's trustworthiness attracts and retains amazing leaders. I could talk about how the mayor came to Ken and asked MedStar to stand up a 200-bed hospital inside the convention center, which was completed, but thankfully never used. I could talk about how Ken used his Rolodex and called upon his relationships across the country to help secure desperately needed PPE. I have many stories, but there's not enough time. Execution. There's one story that captures the essence of the person Ken Samet is. Stacy Samet knows this person. So do his children, Lauren and Jordan. So here's the story. Late on a cool night in April 2020, Ken was heading home from the office. He noticed that a couple of his leaders were hanging out near the entrance to the office. They told him that they were waiting for a shipment of PPE that was long overdue. Just as Ken got into his car, a truck pulled up. The driver said that he couldn't wait for a team to come to unload the PPE. If they didn't start unloading, then and there, the driver would leave with the desperately needed PPE. So the COO and the head of supply chain started to unload the truck. So who else helped? Yep, you're right, Ken. Here he is unloading the PPE. There should be a picture of him up there. I can't see it. Well, if it's not there, I have the picture. It's there. Is it there, Ken? Okay, good. Now that's execution. That's how you build followership with MedStar's 30,000 associates. One thing Ken does is he deflects and distributes recognition. At our most recent board meeting, I announced the recognition that Ken is receiving today. Of course, his first reaction was to say the recognition belongs to his whole leadership team. The board members turned and looked at him and said, no, Ken, this is a result of you. This is all about you. So please, Ken, come forward to recognize your well-deserved award.
Dr. Jones, I'm honored to be here to celebrate all of our leaders in healthcare for their services to the community and to the club throughout the COVID crisis, but specifically to recognize Dr. Stephen Jones with this award. This reminds me of a story back when I was graduating from my MBA program and the hotshot investment banker came and said, let me tell you why I want to manage people's money. There's only two things in the world people care about, their health and their money. And when they're healthy, there's only one thing they care about, and I'm going to take care of that for them. Well, let me tell you, after being involved with Inova, I can tell you when people are not healthy, there's only one thing they care about, and it is not their money. Thank God for all of the great healthcare systems that we have here in the Washington, D.C. area. I moved here 17 years ago with a wife that was in a high-risk pregnancy situation with twins, and we had a successful delivery. We had a great experience, and I've been involved with Inova ever since, and was on the board when we recruited Dr. Jones in. And let me tell you what I've learned about Dr. Jones during that time. First is that his priority is the health of his community. He is focused and has streamlined the institution on that exact goal and only that goal. The second is his abundance of compassion. He not only cares about his community as a whole, but I will tell you he deeply cares about every patient that walks through the doors of Inova, that they have the best outcome and the best experience possible. He is also compassionate about his team. He knows the only way to have a great healthcare system is to have a great healthcare team. And what I have seen him do in building that team and caring for their morale is miraculous. And that is what got the system through COVID. He's done it in a selfless way. There's never been a me, there's never been a complaint, and there's never been an issue of ego. And thirdly is his focus on healthcare delivery and execution. He is a great executor. He has brought tremendous clarity to the system. There were so many accomplishments that Inova had under his leadership, but among them are delivering over 600,000 doses of vaccines to Northern Virginia, nearly a third of the delivery. He played a huge role in influencing the Commonwealth's response to COVID. But perhaps the most important thing he did was keep the Institute focused on their mission and their goal and kept it open. And a great example is we were one of the few healthcare systems that stayed open and maintained access to surgery through the surges. Inova never closed for business. But don't let this man's good looks fool you. He's tough as nails. Some of you may remember the old Purdue chicken ad that says, "It takes a tough man to make a tender chicken." Well, let me tell you, it takes a tough man to run a healthcare system through a pandemic. And with that, Dr. Stephen Jones, would you come up and get your award?
Good morning, everyone. As a proud alum of Howard University, I'm extremely honored to introduce my colleague and friend, but more importantly, a visionary leader who led our alma mater through an unprecedented time, the 17th president of Howard University, Dr. Wayne A. Frederick. A true son of Howard University, Dr. Frederick demonstrated promise and purpose at an early age, enrolling in college at just 16 and earning 3 degrees from the university, including a medical degree by his 22nd birthday. Seemingly always possessing a sense of urgency and a do-more attitude, Dr. Frederick would return to the classroom after establishing a career in medicine to obtain an MBA in 2011. It is this sense of urgency and determination to pursue more that has not only served Dr. Frederick well, but has also been a part of his guiding principles as a leader at Howard University. During the pandemic, when there was so much uncertainty, fear, and misinformation, Dr. Frederick was clear, as was the case with many circumstances before, that Howard University would be a leader and stand at the forefront to ensure that the broader community was supported during these challenging times. As we all were dealing with the shock of having our worlds come to a screeching halt in March of 2020, Howard University, under Dr. Frederick's leadership, leaped into action to ensure that students, staff, faculty, and the surrounding communities were safe and equipped with what they needed during this uncertain time. A task force was formed to determine how to provide support financially, technologically, and even emotionally to those within the Howard community. The university went into action, issuing over 1,000 laptops, Zoom licenses to students and faculty to ensure that everyone was connected as we transitioned to a remote environment. Dr. Frederick and others began to advocate for those who were hit financially by the impact of the pandemic. And through the establishment of the HEART grant, more than $8 million was raised, providing grants for more than 8,000 students. When it came to mitigating the spread of COVID, Dr. Frederick ensured that Howard once again played a pivotal role. At the onset of the outbreak, the university set up free testing centers in some of the hardest hit areas of the district. And when vaccines became available, Howard partnered with the Bowser administration to vaccinate thousands of residents throughout a coordinated effort of students and faculty from all of the health sciences schools. The Howard University Hospital participated in COVID-19 trials, not only to provide treatment for the deadly virus, but also to ensure that trials were culturally representative, a goal that was critical to establishing trust within a community that has traditionally been skeptical of clinical trials. Howard participated in these trials, played a critical role in gathering information that provided sound guidance to communities that were disproportionately impacted by the virus. Perhaps on the one lesser known, but yet still significant acts, was Howard's efforts to address mental health during this period. When we not only faced a global pandemic, but we also faced racial reckoning around social justice. From virtual town halls to live streamed chapel services, it was clear that Howard was invested in the social and well-being of the community. As a vice chair of Howard's board, I have come to know Dr. Frederick over the years. The resolve and steady hand that he showed during the pandemic is no surprise to me. Dr. Frederick ensured that Howard University fulfilled its responsibility to its broader community and that Howard was part of the national conversation as we all tried to figure out and navigate uncharted waters. The Arne Sorensen Excellence Leadership Award is presented to those dedicated service to the community and trusted counsel to the economic clubs was invaluable during the most difficult health crisis of our lifetime. And I think it goes without saying that Dr. Frederick and Howard University stood tall during this time, providing so many resources to those who most needed it. I can't think of a more deserving awardee than the man I have the pleasure of introducing today. Please join me in welcoming Dr. Wayne A. Frederick.
Good morning. Let me first say congratulations to 3 amazing honorees. You inspire all of us. I have the privilege of introducing the last recipient of the award this morning, my friend, Dr. Kurt Newman. When David and Mary gave me the opportunity to speak, I jumped at it because this award connects so many things that are important to me. I serve on the Marriott board, and so I had a chance to see Arne's both leadership and legacy firsthand, and it makes so much sense that the award bears his name. As a dad of 2 daughters, and because Booz Allen has over 15,000 people in this area, we have been touched by Children's National and everything that the hospital does for this community, both personally and collectively. And then most importantly, because I chair the board of Children's National, I've seen firsthand Kurt Newman's commitment, dedication, and passion to the kids in this community. Because more than anything in the world, Kurt cares about kids. David mentioned that 3 weeks ago on June 30th, Kurt retired. You can already see he looks 5 years younger than he did 3 weeks ago. During a 40-year career at Children's National that spanned being a fellow, then a surgeon, then chief of surgery, and for the last 11 years as CEO, Kurt has touched everybody in this community, generations past, present, and future. Few highlights. I have 3 minutes and so much to say, but few highlights. Kurt led Children's National to becoming a top 5 children's hospital in this country and a leader in pediatric medicine around the world. He had this vision for creating a research and innovation campus focused on pediatrics because that is an underserved part of the innovation agenda for this country. And he has partnered with our community to build a system that spanned well beyond the walls of Children's National to really take care of the community, and not just healthcare, but also nutrition, education programs, mental health, and yes, even the school nurses in our region depend on Children's National. And each and every one of these accomplishments are amazing and speak of Kurt's excellence in leadership. But when you really overlay the fact that a lot of this happened during a pandemic, we go from excellence to heroism. And that's how it feels to me. From the start of the pandemic, Kurt navigated Children's National with an extraordinary team that is here today through the most intense and uncharted period in our healthcare history. His leadership was both multidimensional and strategic. Just a few examples. Children's National provided one of the first testing sites for kids anywhere in the country. When Kurt saw the need, he jumped into action. He got donors to create the funding necessary, and the clinic was stood up in minutes. He played a key role in the clinical trials and then the vaccination of children across our region, our community, as well as the staff in the DC public schools. Children share these heart-lung machines with other health systems in a region as demand climbed. He worked with the district to free up beds in other hospitals so that overburdened adult units would have the capacity to serve patients. He shared his expertise and insights on COVID-19, on vaccinations, and on the return to school process. And his commitment to research in this area went well beyond the period of the pandemic, to including being awarded a $40 million NIH grant to study long COVID and the after effects. There's so much to say, but let me summarize it this way. Kurt Newman has dedicated his life to caring for kids and has impacted generations of children in our community. Arne would be proud that Kurt is receiving this award that bears his name. So please join me in congratulating Dr. Kurt Newman on receiving the Arne M. Sorensen Excellence in Leadership Award.